Well, here is something we may not think about as we roll back the clock for daylight saving time Sunday. Many night shift workers will have to work an extra hour, and that includes our night shift workers and healthcare providers.
Yeah, that's right. Kim Estep, Vice President of the Southeast Region of WGU, is joining us this morning to share how the university is showing appreciation to those that work tirelessly by our bedside when we need it most. Yeah. Welcome back.
I am always happy to be here to speak with you. Thanks for having me back.
We are glad that you are here. First of all, nice with the daylight saving singular. Also, I want to know, how are you appreciating these healthcare workers and night shift workers, because it is a big shift in time.
It is a big shift, and most of us don't really think about this, but when we go to bed on Saturday night, either our phones will automatically calculate that extra hour we get to sleep, or we will have to set our clocks in the morning because we're going to go back. But night shift workers who are working throughout that late night actually have to work an extra hour. And so they get to 2 a.m. and then suddenly it's 1 a.m. again. So it's the longest night of the year for them. So we have a lot of graduates, about 3,000 of our Tennessee graduates work in healthcare across the state of Tennessee. And we wanted to show them some appreciation by sending them some little gifts that they can open at 2 a.m. when the clocks change, to let them know we are thinking about them and we know that they have to work that extra hour.
That is so thoughtful. They do so much for us and often don't get the recognition that they deserve. So in your own words, tell us why it is so important to recognize them.
Well, it really is, because these are folks that work in life and death situations, and they're often on the job when the rest of us are sleeping. So they choose healthcare as their profession. Many of them have come to WGU at various points of their life because they want to help people. So that is their goal. I mean, they are there. If we have to be at the emergency room in the middle of the night, that's who sees us, is the night shift. And it's not just nurses, although a lot of them are nurses, but we also have night shift workers that work just to keep the doors open, and EMS workers and pharmacists and health informatics workers who also are working that night shift. So we just want to honor them this weekend.
And we are doing that right here on Local On 2. We appreciate you. Now, WGU has trained healthcare workers across the entire state. Tell us more about that training and what goes into it and what your students are learning.
Well, our students get the really first class training in health and nursing in many cases, and in health related fields from WGU. We offer bachelor's degrees and master's degrees. So we train new nurses. We also take existing nurses who may have an RN they've earned at a community college, but decide they want to level up and get their BSN. And they can do it at WGU. It's online, it's competency based, so they get the chance to move at their own pace. They can work on school on the days they're not working, because there's not a set time they have to log in and work. They have a mentor that follows them every step of the way and helps them figure out what they need to do to pass that next assessment or do that next paper. And so they get a lot of support. And so many nurses, that's why so many since we launched WGU Tennessee have chosen WGU to take that next step in their career. Or they may want to get a master's in nursing, which they can do through WGU, and maybe be a CNO or lead a subgroup at a hospital. And so we offer those programs as well.
And is that why you call it the University of You?
It is, because we meet students where they are. We are completely flexible. Students can choose how many courses they want to take in a 6-month term, and it's one flat rate, which is wild. Nobody else does it that way. So it's up to them the pace that they choose to go, and they have that opportunity to fit it in amongst the rest of their life. Our average student is in their 30s, so they have a job in most cases. They have families, and they have to fit school in those little corners between those other responsibilities. And WGU's model allows them to do that.
Yeah, I tell you what, that flexibility is key. You know, you touched on it. You talked about mentors. How are those students able to access them?
So those mentors all are work from home. They work from home. They don't work out of an office or on a campus, but they actually call their students and set appointments with them. When students begin, they're calling them every week, and they walk through, here's what's coming up in the curriculum, here's what you need to do to prepare. We have a whole community of care that includes not just the mentors, but also other faculty that work on specific courses, other groups at WGU that will assist that student through. So we think of online learning as being students by themselves in front of their computer, but in reality at WGU they have a wonderful group of professionals that are there to help them cross the finish line.
Yes, and rally behind them. Thank you
Yeah.
so much.
Thank you, Kim.
Appreciate you. Okay, everyone, for enrollment opportunities and so much more, you can find them online at wgu.edu.